Hello again, and welcome to another edition of All About DMSO. In this video, we're going to discuss arthritis and how it can be treated with DMSO. There are millions of people in the world today that suffer from arthritis, a common condition that causes pain, stiffness, and swelling in the joints. There's over 100 different types of arthritis, and while some can be relatively mild with minor pain, other types can be very severe with major pain and loss of mobility. Arthritis is the number one cause of disability in people aged over 65. Osteoarthritis, or degenerative joint disease as it's known medically, is the most common form of arthritis and is often caused by wear and tear. In the body, where bones are facing each other in a joint, they are coated with a layer of cushioning tissue called cartilage, and it's this softer, almost spongy layer that enables us to enjoy movement and activities in a relatively painless manner. As time goes by though, the cartilage begins to degrade from usage, the rate of which can depend on things like genetic predisposition, lifestyle, profession, and other such things. This degradation also triggers the production of enzymes that can further damage the tissue. The resulting damage causes the cartilage to become rough, brittle, dry and pitted. Inflammation and stiffness occurs, as well as a decreased function of the joint. As we get older, it can cause much misery and is pretty much the number one chronic pain condition in people over the age of 65. Rheumatoid arthritis is the most inflammatory form of arthritic conditions, and unlike the common wear and tear of osteoarthritis that is associated with aging, rheumatoid can strike at any age. It tends to affect more women than men, particularly between the ages of 20 and 40. Most often, rheumatoid affects the extremity joints, such as the elbows, wrists, hands, knees and feet, and generally tends to persist over prolonged periods of time. The joints become swollen, tender, often red and painful, or difficult to move. Over time, if unresponsible to treatment, rheumatoid arthritis can lead to the degradation of cartilage, bone, tendons and ligaments, which can lead to disability and deformity. Healthcare professionals tend to treat arthritis with anti-inflammatory medications such as aspirin, cortisone and other non-steroidal anti-inflammatory drugs, the purpose of which is to primarily stop the pain from the arthritis and not to prevent or correct the condition. Another problem with using non-steroidal anti-inflammatory drugs is that they can be detrimental to the health of the patient, especially when taken for a prolonged period of time. As well as gastrointestinal and organ damage in some people, they can be particularly harmful to the patient's joints. These non-steroidal anti-inflammatory drugs can obstruct the enzymes that help produce the inflammatory compounds and also inhibit the enzymes that help produce cartilage. So to sum up, the patient using non-steroidal anti-inflammatory drugs will more than likely have some pain relief, but at the same time they will be making their condition worse. This is why people are continuing to explore alternative treatments that can effectively manage arthritic symptoms without having the negative side effects. Medical studies have shown low levels of sulfur in arthritic joints, which suggests the probability that a lack of sulfur is a factor in osteoarthritis, and many people have used glucosamine sulfate to treat osteoarthritis and reported positive effects. Even more positive results have been shown with the treatment of methylsulfonimethane, or MSM, a nutritional supplement derived from DMSO. And people often use MSM because they don't want the bad breath odour that can occur with DMSO. DMSO can help to improve arthritis in several different ways. It doesn't have all the negative side effects that occur when using other non-steroidal anti-inflammatories. It significantly reduces the pain and muscle spasms around the arthritic joints. It reduces inflammation and it improves the blood flow, which can help to bring nutrients to the damaged area. Another important factor about DMSO, and I've mentioned it in an earlier video, is that it is perhaps the most potent free radical scavenger known. Free radicals have been associated as one of the leading causes of many degenerative ailments, and it is logical to assume that they play a part in both rheumatoid and osteoarthritis. Topical use of DMSO over time has shown to reduce the symptoms of arthritis, and many people who suffer with it have recommended using a combination of both DMSO and MSM as the best treatment. Here's a note of caution now. Quite often, people that have been on prescription medication for a number of years feel so good that they wish to stop taking all of the medication and rely solely on using DMSO. This should not be done without medical supervision. Never stop or reduce the medication you're on, no matter how well you're feeling. Always consult your doctor, preferably the one that wrote the original prescription. Inform them of how well you're feeling and that you want to stop taking the prescribed medication, as you may need to stop taking it gradually over a period of time to avoid the possibility of any severe withdrawal results. If you want any more information, or perhaps have a request for the content of our next video, please don't hesitate to get in touch with us. You can look us up on Facebook and Instagram by searching for All About DMSO. We'd love to hear from you and always appreciate any feedback you may have. Please hit the like and subscribe button if you want to see any more of our videos in the future. And I hope to see you all again soon. Bye bye.